So my experience in treating animals has led me to believe that prevention is absolutely paramount. So starting early and not waiting for an injury to occur, keeping the bodies moving well actually helps speed up recovery should an injury happen, and it actually delays the onset of arthritis and degenerative disc disease and many of the complications our senior dogs face. Hi, I'm Dr. Maeg Berkowitz. I'm a doctor of chiropractic medicine specializing in animals. My patients call me Dr. Maeg, and I am an animal enthusiast. So for an appointment, what you can expect is a nice, warm, welcoming environment. I have an office that you can come to, or I can travel to your home, which makes it very comfortable for your animal. I bring my tools. I do a nose to tail exam, the adjustment. I'll be doing some muscle work. I'd also be doing some orthopedic testing and some laser therapy. And at the end, we'll see how your animal has tolerated that particular session, talk about the upcoming session and what to expect going forward. Just because it's a new experience, you cannot prepare for a chiropractic appointment. So there are some dogs that do get a little excited. The second appointment, they know what's going on. They're happy. They felt great. I'm at your house. They greet me at the door, very excited. They know exactly what's going to happen. They know what place we're going to be doing it at. If it's in my office, typically they'll run down the hallway and jump onto the table, and they're ready to go. Some of them are trying to get on the table before it's even their turn. That's how excited they are. Any age is the best age to start animal chiropractic because you can prevent a lot of these issues, contributing to a long-term illness that hasn't presented itself yet. You may not realize that your dog is in pain because our animals are master compensators when it comes to their pain and well-being. They don't want to show us their weaknesses, and that goes back to pack times. But some things, when we pet them and their skin sort of crawls, you may notice, or if they're shaking from nose to tail and it stops part way, that's another way to know that they may need some care. Another great one is you go and you're playing ball and they sort of pick up one leg, or they'll bunny hop, which is the last back two legs. They're not necessarily yelping or showing pain, but these are little signs that say, hey, we should probably go to the chiropractor. One that's missed very frequently is something called a sloppy sit, where the dog is actually sitting to the side rather than in a sphinx position. And they do that because their back is sore and they're compensating for that. Some common ailments that benefit from chiropractic would be allergies. We've got behavioral disorders, disc disease, arthritis, knee or ACL, TPLO injuries, birthing injuries or issues. In my day-to-day managing cases, a lot of times we are co-managing with veterinarians, which is very important. There are veterinarians that do not work with chiropractors, but a lot of my clients have veterinarians that do want to work with chiropractic care, so they'll take care of any of the things outside of our scope, and we'll take care of any of the items such as chiropractic care, massage work, and laser, which is in our scope. So we're able to meld that together for the best interests of the animal. I would say the primary injury or illness that I see in my office is IVDD, or intervertebral disc disease. And this is a devastating injury that happens to certain breeds of dogs where they're not able to walk any longer due to a disc injury. In a lot of cases, they end up at the vet and they're told that they need a very expensive surgery, which I am totally for the surgery. However, a lot of families can't afford the large price tag going along with that surgery. They do find me as an alternative, and I have been able to get these dogs walking in 90 to 95% of the cases without a surgical intervention. So I've treated a vast variety of animals ranging from hamster to water buffalo. That includes camels, chameleons, ducks, turtles. Yes, turtles can get adjusted also. Cows, goats, and alpaca. I'm probably forgetting some, but so far, and I have giraffe on my wish list. Stay tuned. So, like most of us as a child, we're asked, what do you want to be when you grow up? I answered to be a doctor or a black lab. For me, I actually ended up being a doctor and treat black labs, so I got to do both. My background started with a bachelor's degree in neuroscience. I moved on to nursing because I always wanted to be in healthcare with a focus on critical care flight medicine, which took me to the Arctic, and I did my master's degree. During that time, I also had a side interest of animal rehabilitation. Animals have always been a huge focus in my life, and I started a business that worked with sports dogs and service dogs and helping them prevent and treat injuries through physical rehabilitation. Once I finished critical care, I did briefly go on to do MD of humans, decided that that wasn't going to be for me, which then led me to chiropractic school. Chose a specialty in animals, which is an additional study beyond your doctoral program. So all these tools and background have led me to where I'm at today, and I'm excited about the different types of cases that come through that I'm able to use these tools for. So this is Cosmo. He's a senior kitty who had an injury about 10 years ago, so he's got a little bit of arthritic discomfort. This was his first chiropractic session. So after doing some testing, I was able to locate where his discomfort was. We started to treat that area, which he welcomed. Cats typically like body work, they like chiropractic. Where this was his first session, he obviously didn't know what to expect, and he was growing a little impatient, which is completely normal, and we can work with that. So he ended up being in the owner's arms. The cat felt very safe and protected, but was also able to continue getting the care. And he's actually doing very well now after that first session, and I look forward to the second session. This is Penny. She's a senior pug. I first met Penny when she developed an injury that made it so that she wasn't able to walk. She's been under care now for approximately 3 months, and she's walking very well now. And she's getting follow-up appointments once a month, and she continues to move well and got her spunky attitude back. So this is Bubba. I met Bubba almost 2 years ago. He presented to the office covered in hives and just in a lot of pain and discomfort. I was very happy to start treating him. We actually had him pinned up against the wall on the first appointment, which actually halfway through the appointment, he realized it was very comforting, and he was starting to get very sleepy from releasing all that tension. And ever since, he's been such a love bug and absolutely adores chiropractic. The owner has told me that I'm his favorite person now, and he waits for Dr. Maeg to come for the house calls. I like to keep my mind sharp and add tools to my toolbox. You just never know what case is going to come into your office, so I'm actually studying to be a certified massage therapist for animals along with acupressure. I'm looking to study the equine Masterson technique. So if an animal has an acute soft tissue injury, rather than adjusting, which isn't always necessary, we can do massage work and assign some exercises to go home with. That will give them that benefit and pain release. I stay involved in the community by volunteering at Oakland Animal Services and Tracy Animal Services. I like to go in and treat any of the dogs that have an ongoing or acute injury. And that's been really beneficial in getting these dogs adopted, because in a lot of cases, they're much calmer, they're much more pleasant to be around, and they're much more fun, and they want to play with other dogs. So much so they go from not being in a play group to being placed in a play group because they're moving so well and they've got their spunk back. I also foster dogs through Oakland Animal Services. So we typically have puppies or young dogs that will stay with us until they're adopted, and that keeps them out of the shelter and keeps them from developing any further behavioral issues. In a day and age where our animals are like our children, we want to give them the absolute best care, starting from an early age onward. By including an animal chiropractor in that, we're able to extend their well-being. We're seeing animals live longer and longer. If you have any questions or you would like to book an appointment, please do so on my website or give us a call.